Have you been told that Medicare Advantage plans are bad, horrible, and you need to stay away from them? Well, in this video, I'm going to answer that question. Are Medicare Advantage plans bad? If you want to know the answer to this question, keep watching this video. Hi, my name is Patricia St. Louis. I'm a registered nurse and a Medicare insurance agent, a Medicare expert. You can find me at lifeandmed.com. You can also find me at this number right here. Please feel free to call me if you have any questions or if you would like to utilize one of my services. I offer my clients assistance with life insurance, health insurance, and of course, Medicare plans. So like I said, you can call me and reach me at this number right here. All right, so let's answer the question. Are Medicare Advantage plans bad? The answer is no. Medicare Advantage plans are not bad. Unfortunately, there is a lot of misinformation, a lot of misleading information out there. I know that you are bombarded with the Medicare Advantage, also known as Part C commercials. They claim that they would give you up to $140 cash back into your Social Security check. But what they don't explain is how does the cash back plans work? In this video, we're going to discuss how does that work. You know the saying that if something is too good to be true, then the chances are it is too good to be true. Today, we're going to dive deep and I'm going to show you what it looks like when you do apply for a Medicare Advantage plan, give back plan. First, let's talk about what is a Medicare Advantage plans. So Medicare Advantage plans are actually sponsored by private insurance companies. Medicare pays these insurance companies to take on your medical risks. So different insurance companies offer different plans and different rates, such as their monthly premium, how much are your copays, how much you pay for when you see a specialist, also how much you pay for deductibles, co-insurance, hospital stays, skilled nursing facility stays, and etc. Now that you know who sponsored these Medicare Advantage plans, let's look at an example of a regular Medicare Advantage plan versus a Medicare Advantage plan that has a cash back component attached to it. And these two plans that we're going to compare are actually from the same exact insurance company. So we're going to go to the computer screen and take a look. Okay, so look at column 1 compared to column 2. So column 1 is a Medicare Advantage plan, also known as Part C, and we're going to compare it with a Medicare Advantage plan that has the give back component with it. They're giving back $105 each month back into your Social Security check. Both plans are $0 per month. Both plans are also HMO plans. HMO stands for Health Maintenance Organization. It is a network of doctors. You do have to see the doctors that is within that network except for emergency situations. If you wanted to see doctors without needing a referral, then I would recommend that you look at a PPO plan. But for the purpose of this video, we're just going to compare these plans. Okay, so column 1 is the regular Medicare Advantage plan. The max out-of-pocket is $2,750. And column 2, which is the Give Back Medicare Advantage plan, the max out-of-pocket is $4,500. Did you catch that the max out-of-pocket is a lot higher with the Give Back plan? Let's look a little further. With the regular Medicare Advantage plan, you're getting $150 every 3 months to use for over-the-counter products such as compression stockings or toothpaste or Tylenol. Now with the Give Back plan, you're only giving $45 every 3 months. For you, this may not be a big deal. Now let's look at other services. With dental, the regular plan is going to give you $2,000 per year for dental services. With the other plan, you're only going to get $1,500 per year for dental services. Eyewear. With the regular Medicare Advantage plans, you're going to get $400 a year towards your eyewear. With the Give Back plan, you're only going to get $300 every year towards your eyewear, such as eyeglasses. And we already mentioned that the Give Back plan is $105 for the plan that has the Give Back component attached to it. Primary doctor visits, $0 for both plan. If you want to see a specialist, it's $5 for the regular plan and $15 for the Give Back plan. Now let's look at inpatient hospital visits. This is a big one, and I always make sure that my clients know the difference when it comes to inpatient hospital visits. With the regular Medicare Advantage plan, this particular plan is $25 per day for days 1, 2, 3, 4 through 90, $0. Now look at the Give Back plan. It's $150 for days 1 to 5 and $0 for days 6 to 90. Big jump from $25 to $150 for 5 days. You can also see the different prices for diagnostic procedures, lab tests, and x-rays. And you can clearly see that the Give Back plan is a little more than the regular Medicare Advantage plan. Now the question is the Give Back plan worth it? Well, it depends. Are you healthy or not? Do you think you'll be going to the doctor a lot? Do you have a lot of specialists? Would you end up in the hospital? We really don't know. So you just have to make that decision based on your health, your budget, and your healthcare needs. And this is why our office focuses on educating our clients on all of the options out there, so that way they can make the wise decision and decide what is best for their needs. We're going to answer the question one more time. Are Medicare Advantage plans bad? No, Medicare Advantage plans are not bad. It's just very important for you to pick a plan that best fits your needs. Remember, Original Medicare covers 80%, and you are responsible for 20. And that is no cap. So you could be left with a medical bill of $20,000, $10,000 or more. Like I said, that 20%, there is no cap. So it's nice to have a supplement such as a Medicare Advantage or a Medicare supplement plan to help you with the cost of your health care. This video is not going to focus on Medicare supplement plans. We're going to focus on Medicare Advantage plans. So it's better to have something than to have nothing at all, because you don't want to be left with a 20% bill. So the cash back plans actually reduce the amount that you pay in your Part B premium. For 2022, the Part B premium is $170.10. So if you got back $125, let's say, that can be very helpful. But remember, the less you pay in your Part B premium with these Medicare Advantage plans, the more you will pay for copays. Medicare Advantage plan with a cashback component, you may be paying a lot more in the long run if you had to go to the hospital, if you have a lot of specialists. So you definitely want to do the math and think about your health before you choose a cashback plan. So I did want to go over some key points with a Medicare Advantage plan. Point number 1, provider network. So if you choose a Medicare Advantage plan, you will have to be in a provider network. Some of these provider networks are classified in one single county, a few counties, or even statewide. Now, remember that you cannot travel with your Medicare Advantage plan. So if you move to another state, then you need to pick another Medicare Advantage plan for the state, the area that you live in. Now, also remember that there is a difference between a HMO plan and a PPO plan. With a PPO plan, you do not need a referral. So it's very important to look at your provider networks and make sure that all of your providers, your specialists, take the plan that you choose, or you may have to choose other providers. The next point is prior authorization. What is prior authorization? So prior to a treatment or a service, the insurance company wants to make sure that that treatment or service is medically necessary. So the insurance company may request a prior authorization before approving a treatment or service. Now, sometimes the prior authorization may take, a few weeks or so. And yes, sometimes the treatment or service may be denied if the insurance company feels that this service is not medically necessary. So that is very important to take note of Medicare Advantage plans. These plans are managed by private insurance companies. So another point is your max out of pocket. Now, the max out of pocket is actually a great benefit for you. Some max out of pocket can be $7,000, $4,000, $2,000, even $1,500 or less. Do you know what's your max out of pocket? It's very important to know. What does max out of pocket even mean? A lot of my clients think that the max out of pocket is what you have to pay for the plan. No, the max out of pocket is the max out of pocket that the insurance company would charge for your services for that particular year, which is good because you don't want a bill like we said prior. Original Medicare covers only 80%, and you are responsible for 20%, and there's no max out of pocket. There's no cap. So these Medicare Advantage plans helps with that. It gives you a max out of pocket limit. So a max out of pocket is really great to protect you because your finances can be drained really quick with one hospital visit. So know your max out of pocket. You don't want a very high max out of pocket, but look at the overall plan. Don't just look at the max out of pocket, but the first thing that you want to know is what is your max out of pocket. If you're pretty healthy and you just go to the doctor, a few times a year, then the max out of pocket is not a big deal. But if you're not, if you go to the hospital a lot, the max out of pocket is extremely important, especially for an unplanned medical event, such as, God forbid, you got into a car accident, had to be admitted to the hospital. Then after the hospital stay, you had to be admitted to a nursing home for rehab. The scenario can go on and on, but the max out of pocket is there to protect you. So it's very important to know what is that max out of pocket that you would pay if, God forbid, something happened out of your control. Now that you learned a little more about Medicare Advantage plans, here is some of my professional advice. Advice number one, if you choose that you do not want to have a Medicare Advantage plan, you could choose to go ahead and purchase a Medicare supplement plan. You also have to get a drug plan as well. A lot of the Medicare Advantage plans have drug plans attached to it, but with the Medicare supplement, a drug plan is not attached to it. So you will have a monthly premium with a Medicare supplement, and you still have to pay your Part B as well. What's great about a Medicare supplement plan is that you can travel with a Medicare supplement plan, and depending on the plan that you choose, you don't have to worry about copays. So Medicare supplement plans are great plans if you can afford it. Another advice is apply for Medicaid. If you are eligible to apply for Medicaid, if you meet the income requirements, apply for Medicaid. It's a great way to get rid of the Part B monthly premium and to help pay for your medical expense. Like I said, if you are eligible to apply for Medicaid, I highly recommend that you do so. I also have a video that breaks down the difference between Medicare and Medicaid. I will leave that video here, and I will also leave it in the comment section below, so that way you can watch that video next. Another professional advice is that I highly recommend that you do annual reviews on your Medicare Advantage plans. The Medicare Advantage plans do change every single year. Things change, the co-pays may be different, the co-insurance may be different, the give back amount can be different as well. Even the medication that's covered under that plan can be different. So every year during October, the open enrollment period between October to December 7th, you definitely want to go ahead and review your plan to see if you want to make a switch. If you love the current plan that you are in, then stay put. If not, then this is the great opportunity to go ahead and make a change. Remember, the Part B give back plans can be a great option for you if it meets your medical needs and your financial needs as well. It can be a great option. Thank you so much for watching this video. If this video helped you, please like, comment, and subscribe to this channel. And you can always contact me if you would like to use any of my services. My services are 100% free. I never charge for my services. Thank you so much for watching, and I will see you on the next video. Bye.